Hi everybody, Dr. Kaplansky here today. Again, we are going to talk about single tooth replacement options. So what can a person do if they're missing one tooth or maybe two teeth or three teeth, something like that? Traditionally, you would have two ways you could go. Either removable or fixed or permanent or not removable. So what are the choices? Removable is called a partial denture. So it's a removable appliance that you have to take in and out. Fixed or non-removable options, there's two choices there. One is called a bridge. A bridge is something that is cemented to the teeth, to the adjacent teeth, or a dental implant. And we'll now take a deeper dive into all three options. So what's a partial denture? Partial denture is a removable appliance that will attach to the remaining teeth with little metal clasps. So it's these little hooks that hook onto the remaining teeth, and it can replace one tooth, two teeth, or a lot of teeth, depending on the situation. What are the benefits of a partial? Really, the only benefits are cost. It's relatively inexpensive, and it's relatively quick to make. Other than that, there's really nothing good about a partial denture. No one likes to have removable teeth, so you know, it's totally unnatural for someone to have to remove their teeth. And with a partial denture, you have to do that after every meal, and ideally at night. So otherwise, what happens is you start trapping plaque and debris underneath the partial around your teeth, and teeth will decay. What are the other problems with a partial? You can see that it's pretty bulky. So even to replace a single tooth, you still need a lot of hardware on the palate if it's an upper partial, and a lot of hardware under your tongue if it's a lower partial. So people usually complain about the bulk of the material that has to be there for strength. You have to have it with a partial denture. So they're pretty bulky, they're pretty obstructive. Obviously the clasps, the hooks that hook onto your teeth, they can do some damage to the teeth over time. As you can imagine, when you chew on the partial denture, the partial moves a little bit, side to side, up and down. All that movement causes rubbing of the clasps on the teeth, so it leads to premature wear on the teeth. Another problem with partial dentures is they tend to break down over time, so nothing is forever. The plastic teeth can crack or break off the metal framework. Sometimes teeth just pop out. People come back and they say, Doc, I lost my tooth. So then we have to take the whole partial away from them, send it to the lab, and they will repair it, but the patient is without teeth or without a tooth for that time. So these are all the problems with partial dentures. So they're removable. That's, like I said, is not very natural to have a removable thing in the mouth. They also block the sensation to some extent. The taste is going to be affected. The sense of temperature is going to be affected. And it's just really an old treatment modality. It's something that has been around for probably a couple hundred years, and there's way better things nowadays. So now let's move on to the next. The next two options are permanent options. So permanent options meaning that they're not removable. Permanent doesn't mean that they last forever. Permanent means that they are not removable by the user, by you. What are the choices? Bridge or a dental implant. So we're gonna now talk about the bridge. So let's say you're missing a tooth. Here's a nice, good oversized model that shows all that. So you're missing a tooth, and you have two adjacent teeth. So what do? In order for a bridge to attach to these two teeth, we have to trim the enamel off of this tooth and off of this tooth. And then a bridge is a single structure like this, made in 3 parts, kind of, will be cemented over these teeth, and it replaces the missing tooth. So once the bridge is done, on the outside, everything is going to look exactly like it did if you had a tooth in there. So the only funny part about it is you can't floss in between because it's all in one piece, right? But most people don't complain about it. They're like, oh yeah, I can't floss. That's great, because they don't floss anyways. But you should floss. So this is a bridge. Now, what are the benefits of a bridge? So the bridge, again, can be done literally within a couple of weeks, 2-3 weeks, and you can have a bridge. So it's very fast, right? You can do it quickly. What other benefits of a bridge? Well, obviously it's not removable, so that's nice. Compared to a partial, a bridge is better because you don't have to take it out. It looks exactly like your teeth. There's no hardware on your palate. There's nothing blocking your taste or the temperature. Keeping it easy is relatively simple. You just brush it on the outside, and then there's a little gadget called a floss threader that you thread in between the teeth over here to clean underneath the bridge. You have to do it. It's not difficult. It can be done. So that's the bridge. These are the benefits of a bridge. What's the lifespan of a bridge? Probably 7 to 10 years. Bridges are made of porcelain. They're made of ceramic material. So over time, what can happen is the porcelain can chip, it can break, or the teeth underneath can start to develop cavities or other problems, gum disease, and that can lead to a loss of a bridge. Now, what are the downsides of a bridge? Now that we covered the benefits, so what are the downsides? The biggest downside of a bridge is the fact that it does absolutely nothing to maintain the bone where the tooth is missing. So when you lose a tooth, your bone starts to shrink away. Your body takes all that calcium and uses it elsewhere, right? Because it's not needed there anymore. So a bridge builds a bridge over that area where the tooth is missing. And what that does is your body continues to shrink that bone away. So the bridge doesn't do anything. So a lot of times when people had bridges for 15 or 20 years, for example, and they come back, we see a huge concavity underneath the bridge. The bone shrinks away, the jaw shrinks away, both horizontally and vertically. So especially if the bridge is in the front of your mouth, over time, it's going to look very, very unsightly when you smile and you show that huge black gap underneath the bridge. So between the bridge and the gum, there's going to be a space forming over the years. That's the problem of a bridge, right? So at that point, traditionally, years ago, what would you do? You would remove the bridge and make a new bridge with longer teeth. Doesn't look very pretty, but that's what people did when they had no other choice. Now there's other choices. So that's a problem of a bridge. Now, what other relative problems of a bridge concept? The fact that you have to trim 2 healthy teeth down. That is absolutely, by today's standards, not a cool thing to do anymore. So imagine you have 2 healthy teeth, and in order to replace a missing tooth in between, we have to cut all the enamel off of 2 teeth in order to put the bridge on. So that, over time, will expose these teeth to cavities, to root canal treatments, all these things that people have to deal with over time with bridge work. This is how that chain reaction gets triggered, right? So you strip the enamel off the tooth, and then the tooth gets susceptible to cavities. Eventually the nerve may get damaged, so you need a root canal treatment. That is a problem with the bridge. Now, what other problems are with the bridge? You are tying 2 teeth together into one design, right? So these teeth, naturally, human teeth, are designed to have a little shock absorber built into them, right? So when you bite on the tooth, there's a little ligament connecting tooth to your jaw, to the bone. So when you bite on the tooth, the teeth will get depressed a little bit. That movement, that micro movement, over time can break down the cement that holds the tooth to the bridge, right? So over time, what can happen is one of the abutments gets loose, but the other one is still attached, and you don't know about it. So there's saliva leaking underneath, there's bacteria having a party in there, and eventually, again, what that's going to do is lead to a cavity or a root canal situation. So that's a problem. It's never a good idea mechanically to connect two moving structures with a rigid fixation, such as bridge and cement, right? So over time, that can be a problem. This is it, basically. That's what bridges are all about. That's how they work. Do we still do bridges? Yes. There's still cases where bridge is indicated, where bridge is an okay option versus others. Say a partial, definitely better than a partial, or a dental implant even. But all this is decided on an individual basis. So each patient is unique and different. Now, the next option that we're going to discuss is a dental implant. So what's the next option? What is a better option to replace a missing tooth? If it's not a partial, if it's not removable, and it's not a bridge where you have to cut down healthy teeth to replace a missing tooth, what is out there that actually is not removable, that doesn't damage the adjacent teeth in any way, and actually does preserve the bone and stops the bone loss and stops the shrinkage? It's called a dental implant. Dental implant is the best tooth replacement option we have in dentistry as of right now. So let's consider a situation. We have a missing tooth. So there's two adjacent teeth and there's a tooth missing. What we would do is we would place a titanium cylinder in the jaw that acts as a missing root of the tooth, and this titanium cylinder then will serve as an anchor to attach a tooth to it. So the cylinder is going to sit there and integrate for a few months. Then on top of it goes a thing called an abutment. Abutment is the part that will connect implant with a crown, and then the crown is attached to the abutment, and that pretty much completes the restoration. So what are the benefits of dental implants versus, say, a bridge? We already talked about the fact that we don't need to cut down adjacent teeth. That is a huge benefit. We already talked about the fact that implant preserves the adjacent bone. So once you place the implant back into the jaw where the tooth was missing, your body is tricked into thinking that, oh, there's a tooth there now. So maybe I need to keep that bone around. So it stops the bone loss, it stops the shrinkage of bone. And obviously that translates later to maintaining the shape of your face. You know, it's a big cosmetic issue down the road when people get older. With aging and everything starts to shrink and distort a little bit in the face, if you're missing teeth, that process is definitely accelerated. So your facial features are going to change over time because of missing teeth. And the way to stop it is to place dental implants in there and replace teeth with dental implants. So talking about longevity of the different restorations, the bridge longevity is, like we discussed, about 7 to 10 years on average. Some can last more, some can last less. Dental implant, if everything is done properly and you maintain it well, meaning good home care, professional maintenance every few months at the dentist, implants can last a lifetime. And they can serve for a very, very long time. There's data now going back to the early 80s. So we're talking about 40 years. Some implants have been in the mouth for 40 years and function. And they still work really, really well. Now, dental implants, placing them and restoring them is a bit of a longer process. So that is a relative downside of a dental implant. So where a partial can be made in a few weeks, a bridge can be made in a few weeks. it takes about 3 months, 3 to 4 months, to restore a missing tooth with a dental implant. Is it a problem? No, it's not a problem, because you can always replace that missing tooth temporarily with, say, the same partial denture in the meantime, and then just chuck the partial in a few months and have the dental implant done in there. So that is a huge advantage, that dental implants are long-lasting. They preserve the bone. They do not affect adjacent teeth. They do not decay. It's titanium and ceramic, and they're very, very strong. So we don't really see them breaking. That pretty much completes our today's presentation on single tooth replacement options. We've covered partial dentures, bridges, and dental implants. I think you guys should have a pretty good understanding now of the different choices and their pros and cons. Hey everybody, thanks for watching us today. It was great fun presenting different options to you. Again, my name is Dr. Kaplansky. If you're looking for a solution for missing teeth, whether it's a single tooth or a full arch of teeth or a full mouth of teeth, we are here to help. Give us a call. My practice is in Gasport. The number is 716-772-7500. And thanks again for watching.